I'm going to start the meeting. I'm going to start our Board of Health meeting. Today's April 28th, 7 o'clock, 7:05 now. And so I'm going to call the meeting to order. Some introductions. My name is Caroline Kinsella. I am the Health Director, and my Assistant Health Director, Emily.
Hi, I'm Emily. I'm the Assistant Health Director.
And Clerk of the Health Department, Jean. You're muted, Jean, but I see you. And Laura is our Chair of the Board of Health.
Laura Richards.
Roxanne Musto, member.
Hi, Roxanne Musto, member.
And Mary Stenson.
Hi, Mary Stenson, Secretary.
And Lisa Goodnight did not make it tonight, but I do have a statement from her. So next we'll go to number 2, approval of the meeting minutes for March 3rd. If the board could take a look at the meeting minutes for March 3rd. Do you have anything to add or?
No, I already looked at it.
I read them earlier. They looked fine to me.
I did too. They looked fine.
I agree. I'll make a motion that we approve the minutes then of March 3rd.
I'll second. All in favor?
Aye.
Aye.
You just see if there's any more people in the waiting room here.
Nope.
No, that's the only one. Okay. So the meeting minutes have been approved. We're going to go on to number 3, Citizen Speak. Is there anyone that would like to speak at Citizen Speak?
I would just say not today, but soon.
Thank you. Okay, we'll move on to number 4. And number 4 is the public hearing. So I'm going to start the public hearing at, now, 7:08. And this public hearing is to discuss and vote to approve additional proposed regulation changes to the Board of Health Regulations, Chapter 5, sale of tobacco products to minors, and Chapter 6, Board of Health Regulations, smoking in workplaces, public places, and membership association. I just wanted to say we've been working, the Board of Health and my staff have been working on these regulations for a number of months now. So tonight we're planning to vote on these regulations, but before we vote on the regulations, and the regulations are on the Town of Milton website, we have reached out to our tobacco retailers and given them notice. It's been in the paper twice to let them know also, and Carolyn Ho has chatted them to let them know that we're having a hearing if they wanted to say anything. And just before I open it up, I do want to say that Lisa Stevens Goodnight, who was helping us, and she's been great these past couple of meetings. She was unable to at the last moment. She couldn't make it tonight, but she has a statement that she wanted me to read. So I'm going to read this statement before I open it up. This is from Lisa Stevens Goodnight. She says, "My name is Lisa Stevens Goodnight. I am the Director of Tobacco Control for the Massachusetts Municipal Association, which represents the 351 cities and towns across the Commonwealth. The MMA's Tobacco Control Program is a grant project awarded to the MMA by the State Department of Public Health, and through it, I provide technical and legal assistance on tobacco control issues at the municipal level. Commercial tobacco remains the leading cause of preventable disease and death in the United States. Cigarette smoking is responsible for more than 480,000 deaths a year in the United States. Since nearly all tobacco use begins during youth and young adulthood, reducing youth access to nicotine products is of great public health importance. In 2022, 24.8% of middle and high school students reported having used tobacco or nicotine products. In addition, nearly 1 in 9, which is 11.3%, middle and high school students reported current tobacco product use. Among all students who currently used any tobacco product, 31% reported using multiple tobacco products during the past 30 days. Multiple tobacco product use among youth is particularly concerning because it is associated with nicotine dependence, which increases the likelihood of sustained tobacco use in adulthood. According to a recent report from the Campaign for Tobacco-Free Kids, approximately 7,600 kids under 18 will try a cigarette for the first time this year. The regulations proposed are data-driven policies developed and proven to reduce nicotine initiation among youth. I recommend adopting these measures and commend the Board of Health for taking this important step forward in protecting and improving the quality of life for residents in Milton. As I said, she was unable to come tonight, and she has apologized and sent that statement for me to read. And now I'll open it up to anyone who wants to say anything. If you can just say your name, I appreciate it. And if you have anything to say about the tobacco regulations. I don't hear anybody. Is anyone trying to? Is anybody coming in or anything? No? Someone has raised their hand. Okay, let's see. Maureen Busby. Would you like to say something?
Sure. My name is Maureen Busby. I am the Regional Tobacco Program Manager for the Mystic Valley region. And I glanced quickly at the regulations that you're reviewing, and I appreciate that you're updating your regs and taking the youth prevention seriously. In some of my communities, in fact, 6 of 7 of my communities in the past year adopted nicotine-free generation. And I didn't see that in your regulations. And I just wanted to mention it tonight, where it's apparently not being discussed tonight, but I wanted to suggest that maybe at some future time, this board would consider this important public health policy that will do a great deal to prevent future addiction of our young people, which, as Lisa mentioned in her statement, continues to be a problem across our state, across our nation. Thanks very much. And do you need my address for your record?
That's a good question. Jean, do we need Maureen's address? And you're on mute. You're on mute, Jean.
Could take it anyway.
Yeah, I'll take it because I
Okay,
can't
sure.
get a hold of.
Sure.
Jean.
I'm at 54
Yep.
West Highland Avenue, Melrose, Mass.
West Highland Avenue, Melrose, Mass.
Correct.
Okay, I appreciate you coming on.
Thanks very much.
Thank you. I see that Zachary Rich has raised his hand.
Hello, my name is Zachary Rich. I'm a pulmonologist and critical care doctor with Boston Medical Center. I'm also a father, and I am happy to have this chance to talk with you and would invite you also to support nicotine-free generation legislation. I think this is some of the most important work that can be done by the Board of Health. I work in the intensive care unit where during COVID, we filled every single ICU bed with COVID patients. And shortly after the vaccine, we saw a steep drop off in the number of COVID patients that was filled up with people with tobacco-related diseases. I make my living treating tobacco-related diseases. I take care of patients that have lived their whole life with tobacco, and almost all of them regret ever smoking in the first place. And this is something they've feel ashamed about and embarrassed that they can't quit. To me, nicotine-free generation is a truly genius legislative proposal that has been adopted by 15 towns in Massachusetts. It ensures that anyone that can currently buy tobacco products will continue to be able to buy tobacco products in your town, but anyone that cannot currently purchase tobacco products will not be able to, and be able to learn from my and previous generations and avoid the truly harmful effects of nicotine and tobacco. And I thank you very much for considering this, and happy to help with this legislation in any way I can.
Thank you. Is there anyone else that would like to speak? If anyone has their hand raised. Jean, does Mr. Rich need to provide his address?
They really don't, just their titles are good enough.
Great, thank you. I thought. Just checking. I don't see anyone else raising their hand. Wait another minute. I've had one or two people that have come in just recent into the room. So we're right now in the public hearing. Someone else has raised their hand. Let's see. Katie
Hi.
Silbog.
Yeah, hi. My name's Kate Solbaugh, and I'm a law professor at Boston University, and I'm a resident of Brookline. And I think a number of people have hopped in just to support you guys for adopting the rules you're about to adopt, and again to kind of offer any support we can on future consideration of nicotine-free generation. I've been working on it for a few years. I've had a number of other people on the call, including Mark Gottlieb at the Public Health Advocacy Institute, who's also hopped onto the call. And just to say, I hope you guys will look at it, and just to offer any support we can offer. I was a co-sponsor in Brookline, and you know, we're very optimistic about where this is headed, and just would love to have Milton on board. Thank you.
Thank you.
Thank you.
And I see someone else raising their hand. Hey, Mark.
Hi, Mark Gottlieb, Executive Director of the Public Health Advocacy Institute. I wanted to echo Professor Silbaugh's points and offer specific help should you decide to learn more or proceed to think about the nicotine-free generation proposal. My organization defended the town of Brookline all the way to the state Supreme Court when they enacted this this policy, and it is now absolutely valid throughout the Commonwealth in terms of its legality. However, as we did with Brookline, our organization would stand by any community that adopts this policy and defend them, even if it's all the way to the state Supreme Court. And I just wanted to mention that as the type of support that that we would be delighted to provide, but you would be unlikely to require, because I think all of the legal status of this has been well established. Thanks.
Thank you. Is there anyone else that would like to speak tonight? I don't see anyone else that has raised their hand. I know the board has been working on these regulations for a number of months. They're set to finalize them tonight and vote for it. They approve it. Would any of the board members like to speak or make a motion?
I'll move to approve the additional proposed regulation changes to the Board of Health regulations. Chapter 5, sale of tobacco products to minors, and Chapter 6, Board of Health regulations, smoking in workplaces, public places, and membership association.
I'll second.
All in favor?
Aye.
When would you like these regulations to begin?
Um, let's see. So all the businesses have been notified, Caroline? When were they notified?
They were notified probably 2 or 3 weeks ago that we're having a meeting, went into the papers.
Right.
And so they maybe, some of them said they were going to jump on and listen.
I mean,
Uh,
as soon as possible.
Are we gonna send them the final regulations?
What
They
about
have-
June?
They have the regulations, so they know what's in the regulations, and they're on the town website. You know, there
Okay.
may be some that may have that nicotine pouch that might be more than 6 milligrams, and that was something that we did add. They may have an 8 milligram oral nicotine pouch, so I'm not sure about that. I don't know if we want to give them 3 or 4 weeks, you know, to,
How about June 1st?
That sounds reasonable.
Okay.
okay. All right, so we'll have that June 1st, and if you guys can come in and sign the new regulations, and then I will send it to all of our retailers, that'd be great.
Okay.
Okay, thank you.
Thank you.
Thanks.
Any other discussion before I close this public hearing? Okay. All right, I'm going to close the public hearing at 7:22. Okay. Thank you. Thank you, everyone. Okay. Next up, number 5 is the health director's report. I've got a couple things that I wanted to tell the board about. Let me pull all my stuff together here. The first is that Margaret Carrells resigned on April 17th, and she was our drug-free community program director. And so I've posted 2 positions for 18 hours each for part-time staff, and we're currently advertising it. So I just want to let you know that. Okay. Another thing is I want to say we did have our drug take back over the weekend with the police department, and it was pouring. So we did have a couple of people that did bring back some medications, but the amount of people was way down compared to last year, because I think it was pouring rain. I might have thought it was canceled, but it wasn't. So that was from 10 to 2 at the Milton Police Station. It's always good to partner with the police with that. I also want to mention that Carolyn Ho and Emily Connors, they applied for a National Environmental Health Association, another grant award for the U.S. Food and Drug Administration, and they received $16,000 for that. So these are to complete some standards. They could possibly go to some conferences or hire a consultant to help them with the standards. So I think that's great for Carolyn and Emily if we receive these funds. And then Sue and I are going to attend the Mass Association of Public Health Nurses annual conference, which is on May 14th and 15th, and that's in Wakefield. Emily and Ann is going to be attending the Montana Summer Institute Science of the Positive and Positive Community Norms Framework training the week of June 17th. 5 to 9 Thatcher Street. I've been emailing Tara Ruddle with the Neighborhood Renewal Division. She's had a death in the family, and hopefully we can get in touch with her this week. But we've been back and forth talking to her about that. So I will continue to reach out to her and hopefully we can connect with her this week about that.
Caroline?
So,
Caroline,
yes.
can I ask you a quick question about that one?
Sure.
Have you connected with Nick Milano on that as well? This came up somehow when I was talking with him recently, so I would like to maybe if you can just let him know what you've been doing with that,
Sure.
because
I
I
think
believe
that
he
I
might have had
did,
someone that
but
inquired about that or what was going on with
yes,
that.
there was a
So if-
neighbor. Yep,
Yeah, so if you can touch base, that'd be great. Sorry to interrupt.
will do. I'll touch base with Nick.
Thank you.
Sure. A Riverside recovery coach has started for our the opioid abatement money. So we've been working on this for, I would say, at least a year to get a recovery coach in place. So now on our website on the health department tab, someone can go there and have a Riverside recovery coach help them with any kind of opioid problem that they may have, and it's for free, although they do take insurance. But we finally got that off the ground, which is great.
Great, great.
And then one of the community health improvement planning strategies that we identified in our CHIP was to have more home visiting programs. And I just want to let you know that we've been working with Wellesley Health Department, and we've been working with more than Wellesley, but it's Wellesley and I that have started to take the lead on this to develop a maternal, child, and family health program. And we're not really sure exactly what this will look like. We have about 250 to 300 births in Milton every year, but we're trying to develop a program where we can at least, first step is touch base with the new moms or new birthing people and make a connection and help them with access to any kind of clinical care that they need. And possibly we could go for a visit, like either Sue, there is supposed to be a regional nurse also that was supposed to kind of take up this mantle and help us with this. And they're going to be rehiring a regional health nurse. So this is within the shared services grant. And they were supposed to start this recently, but the nurse, Kristen, she just, she's given her notice, but she may be able to do part-time, but we're hoping she can continue on through the shared services. But we are starting conversations with this home visiting program. So just to let you guys know.
Caroline, quick question on that.
Yeah.
Are,
Yep.
are there anything like Newton Wellesley has maternity and so forth? And I know you're working with Wellesley as well as on this. Do they have
Yes.
any kind of outreach program or anything that could piggyback with something like this? I'm just wondering, or they have a
You know-
nurse or something?
That's a really good question. And you know what? I'm going to show you something that is happening on the North Shore. It's the North Shore Mother Visiting Partnership. So they started this in the North Shore, and this is all the towns on the North Shore. And this is kind of mirroring this on the North Shore of what they're doing. And one of the foundational public health services now is child maternal health. And so that's a good question. I think they will be connecting in with Newton Wellesley.
I just thought because they have maternity, that's why. I mean, we don't have maternity, at BI Needham or
Right,
BI
right,
Milton.
nothing at
So,
Milton.
right,
Yep.
that's why I was thinking of that. South Shore does, but
Right, right.
yeah.
We'll explore that. I'm going to write that down about Newton Wellesley. And I think that Amanda, who is a retired public health nurse, but she's been brought back on for some hours in Wellesley, is kind of starting up these trainings. And I put it into my notes here about the training. So interestingly enough, there's going to be some trainings. And the good news is that we don't have to pay for it. Wellesley's going to pay for it. So there's 4 trainings from the Jewish Family Child Services. I think it costs $4,500 for 10 people to go to these trainings. So we're kind of piggybacking onto this to find out more about it. But as I said, it's going to be similar to the North Shore Mother Visiting Partnership because this program from the Jewish Family Child Services, they were involved with the North Shore Mother Visiting Partnership and kind of guided them along in the beginning. So Sue and I are going to attend the trainings, and also Ann, because you can have a social worker go also. And we'll have to see, I know there's 250 to 300 children that might be born in Milton, but maybe not everybody would want to visit. maybe they just want some paperwork, or they just want to call and say, we're here if you need to see us, or we can go out and see you. So this is in process, and I'll have to see how that goes. And then switching
Sounds
gears. Does anybody have any other questions about that?
It sounds good. I wonder if they must have screening tools, more high end than what they used to have to hopefully refer them.
I think they're developing the screening tool right now, and when we find out, we will. I can share the screening tool with everybody.
Great.
So it's all being developed, but it probably will, as I said, mirror the North Shore, what they're doing on their screening tool. Has anybody got any other questions about that? I'm going to switch a gear, and I'm going to say that we had some complaints about beavers again. So we had complaints last year about beavers at Turner's, and there's also some flooding going on at Pine Tree Brook. And originally, Marina, who reached out, and she said we do a site walk, and she's connecting also with DCR, the Office of Dam Safety, and they came out to one of our calls last year. But I'm waiting to get a date if we're going to go out and take a look at the flooding. I did have one person call the office about Turner's Pond, and I did walk around Turner's Pond. They were concerned about trees, that the beavers were eating some of the trees. I was able to go out and I saw possibly 3 trees that the beavers had shredded. But this person said they were going to send me more pictures of the damage at Turner's Pond. So it's not flooding anything at Turner's Pond. You go to Turner's Pond, it's behind a gray house, she said. I didn't see the beaver dam initially, so I'd have to go back out. I think it's about the same place it was before, but I really didn't see it, and I was looking for it. But I will talk to Marina about that and see if we can get, a time that we might be able to go take a look at it or see what's going on there. So I just wanted to put that on your radar.
Was it Harland or Pine Tree Brook? Because I felt like it was, I know that when they came out before, that was Harland when DCR came out, right?
No, I think it was Turner's, and then we had pictures. Remember?
It was Turner's, and this time I'm reading Marina's email here. She said, I was informed that there is a beaver dam located within the floodwater storage area of Pine Tree Brook Flood Control Dam. So, but there's a map, and on the map, you can see Harlan Street on it too.
Oh, okay.
Yeah.
So, and Unkety Road. So I'm not exactly sure, but it looks like there's a beaver dam that was observed on April 16th.
Okay.
Okay.
To be continued about the beavers. And there's some pictures about what the beavers are building. So I'll connect again back with Marina to find out more information about the beavers. And I'll let you know.
Okay.
Thank you.
Yeah. A couple other things is we're having a focus group. Will be our last focus group for the CHIP. And that's on Thursday, May 1st for community partners and service providers. We have 11 people coming so far to that focus group discussion. So Sky has done a wonderful job with these focus groups and reaching out to stakeholders, and she's gathering a lot of information. I'm thinking that she will be done with her information gathering and probably putting reports together of what she found potentially in June. So she's coming to the end of her gathering of information around opioid use in Milton and input from the town members. And we also are still doing the opioid survey. So that's on the town website, and we'll continue to get people to take the opioid survey.
So this meeting on Thursday, the 1st, this group discussion, what time is it from and who's invited?
So it's 5:30 to 7. It's at the old fire station behind Town Hall, and it's for community partners and service providers. And the light supper will be provided.
So who in particular, when you say that, sort like who is invited, like who's going? Like,
So I
are you
do think,
talking like the hospital? Are you talking,
so
like-
yeah, it went out to the hospital, it went out to the fire department and the police
Mhm.
department. Also Rockland Recovery, I think a couple of people from Rockland Recovery may be coming. Yeah.
Mhm.
So,
Okay.
Okay.
I also want to mention Mass in Motion, there's a breakfast coming up. And this is their annual breakfast. Lisa Courtney's putting this on, and this will be, let's see, April 30th. On a Wednesday, and 7:30 to 9:30. And this is Mass in Motion grant, and so you can just drop in, there's no formal presentation, Lisa said, but she just wants to talk, she'll probably talk about the food pantries and what's going on with them, and just to kind of meet everybody from the food pantry, like they did last year, which was great, because I think that we just didn't know who was who exactly, so it was nice of them to come and just talk about their needs at the food pantry.
Mhm.
And anyone's welcome really to this annual breakfast. So
Okay.
that's on Wednesday morning at the old firehouse. And you can RSVP if you want, if there are any dietary restrictions, or just drop in. Another switching of the gear. So after we finish our chip, this is something for the board to think about in the future. After we finish the community health improvement plan and come up with our strategies of what we're going to be doing. Another thing we may want to think about down the road is applying to be certified, and it's Public Health Accreditation Board certified. It's called FAB. I don't know if anyone has ever heard of it, but what it is, it recognizes health departments. There are a couple health departments in Massachusetts that have applied to be FAB certified, but it sets our health department against like national standards. And I know I'm always bothering Emily and Carolyn to say, like, what's our standard operating procedures like? And what it does is it has like standard operating procedures, and it makes your health department more efficient to serve the residents of your community. The downside to that is the cost. So readiness and training fee is $1,299. And then you submit all your documentation, and that takes about a year. And then it costs $5,600 a yearly fee to remain accredited. So every year it's $5,600. It's a lot of money. But when I talked to the shared service grants providers, they were talking about I could contact FAB and I could ask them to decrease that amount of money, because we're a small health department. So I could potentially get that amount down, but it's kind of like a gold standard. You know, I don't know if I said that to you, is that when I meet with my shared service, other towns that we meet with, the 7, no other town has done a community health assessment. No other town has done the community health improvement planning. And then a next step would be getting this FAB certification, gold standard. But again, it has to do with money, and it is a lot of money. You know, I could contact them and see if they could get that amount down. I also have a PowerPoint because I've met with the shared service grantee people, and they put together a really nice PowerPoint about exactly what this means and what it is. And I can share it with the board, and we can talk about it further, and we can discuss it a little bit more down the road, because we haven't finished our chip, but it's just something to think about. And maybe we can afford it. Or maybe we can even, apply for a grant or something to be able to afford it. So I just wanted to put it on your list of thinking of getting something like this, because as I said, it's a gold standard to be FAB certified. And I will send everybody a PowerPoint so you'll know the costs and what this really means. And then I want to switch another gear, and just to say that we did get the letter back from the Commissioner of Public Health, Robbie Goldstein. We had a letter that we had sent out asking for a healthcare capacity assessment, immediate healthcare capacity audit. And we did get a letter back. And I think I shared it with everybody, but I just want to mention it again. We can put that on the website too, you know what they said, but they said they want to thank our team for ongoing collaboration and commitment to addressing the public health impact of elevated emergency department and inpatient capacity in the town of Milton. So,
So Caroline, we brought this up at our last select board meeting, and we sent this letter out in January, February, and we just got a response to it in April. So it was quite some time before we got a response. And then the considerations of what were in the letter was a bit of an issue too, because it didn't directly address bed capacity in the hospitals. It was more, talking about community health. It just didn't really address like the things that they targeted were completion of a MOLST form, and they're getting people to sign up for, long-term care, Medicaid, and all this sort of thing. But, the problem is the bed capacity in the hospital beds and the availability when we're having people wait in the emergency room for days to get a bed.
right.
An emergency room that's has more beds to take care of that end of things is fine, but it's not inpatient. So at the end of the letter, it did say something about, willing to talk, with the community or whatever. So the town administrator had thought that we might do a follow-up with that, Caroline,
Okay.
where he was going to try to reach out to them
Oh, okay.
with that, because there is concern, like, will we have enough beds for people that are here now in the community?
Now, Roxanne and Caroline, I think there are state regs for bed capacity, and it's like certificate of need. And you would think that that would be higher with Kearney closing. So I think they can formulate some numbers according to that state.
Well, they gave us, it was interesting in the letter, there was a 1 week period in March that they gave us what the capacity was, but certainly it wasn't during some of the really high weeks that we had. It was like 89 or 80, it was in the 80% filled basically, but it wasn't, I'm sure it wasn't one of the weeks that, during that whole period of time, that would have been the weeks upon weeks that I saw the other end of. So you have the letter in front of you, Caroline, right?
Yeah, you're right.
Yeah.
They're all just saying 1 week. And we were lucky this year, really, with the flu. I mean,
Right.
we were.
Yeah.
Yeah.
So.
Well, it gave us 1 week in March. You're right.
Yep. So we're trying to, work on that end of things.
Mm-hmm.
Thanks.
Yeah. All right. I'll follow up with Nick about that. I'll follow up with Nick. Okay. Okay, dokes. Let me see if there's anything else. Or is there anything else that anyone would like to speak about?
Caroline, I was looking at, this is April 16th paperwork from the coalition. And I was you have it handy there. It was in our packet.
The Milton Coalition? Yes.
Yeah. But I guess we're just backing up a little bit, but I think maybe they were going to use a Kahoot with it says down here, let's see, which line was it? They were going to use the Kahoot with the kids to talk about emotional distress in anyone that they thought had a mental health issue. But the Kahoot game is used in younger grades. It's usually used up to age 12. And then there's another mid-range kind of a survey game called Blook It, and that's up to age 18. And then if the kids are older and they prefer to gather information somewhat anonymously, they usually use the Padlet now. So I didn't know Is
So
this,
I'm looking, sorry for interrupting, I'm looking at this Milton Coalition report. This is Margaret Carell's last report.
right?
So
But
I'm
I
just
don't
trying to
know-
find out what you're talking about on
I
here.
don't know how it says here. It's working. Let's see. There's A and B in the middle of the page, so this would be B. It's working on a mental health focused Kahoot.
Oh,
for
I see it. I see it
students.
now.
So I just think we need to drill down and get a little more finite about the age of the students, because the younger kids use Kahoot. And then, like I said, the mid-range age group uses Blooket, and then the older kids use a Padlet. And usually, you gather your information and you go from there with whatever crisis counselors are present or guidance counselors, and they know how to intervene according to the information gathered with those games. But that Kahoot game wouldn't be for older kids. So
I'm not familiar with that game.
I just wanted you to know it. It's kind of a
Not for the kids, okay.
it's a curated, created game. It's a nice tool for younger children. And then if you look it up yourself, maybe tomorrow, look at it, you'll see that it is definitely for younger kids. It's not for all ages. So I didn't know if maybe we could kind of just revise that slightly. So the tools used would be for the specific age groups.
I could ask,
Just so we can get accurate determinations instead of,
mhm.
they wouldn't be as accurate using that
Kahoot.
for older kids. Yeah.
Okay. So Margaret has left the position now. I'm just trying to think. I know there is a teacher that works with MIAC. Her first name is Miriam. I have never met her, but Ann Grossman, I think, is going to be working with her. She could ask the question further
Sure.
and contact Miriam.
Okay.
Because I don't know exactly anything about that Kahoot. So I can make a little note here.
I know all about Kahoot. So,
Yeah.
and the Blooket and the Padlet. So it's
Okay.
if we can talk about it further. I just wanted to bring it up tonight.
Okay. All right. Thank you, Mary.
Thank you.
Anybody have anything else?
What's with the map of Marbella?
Oh, I got that from Andy D'Amato.
Uh-huh.
He sent that in to us. Marbella has not, they've submitted their plan, I guess, to the planning board. But he was concerned that if you look at the map, that there were going to be drinks that were taken from one area to another,
Oh, carried across.
that threshold. He had asked if the Milton Coalition could vote on it, and I said it wasn't the Milton Coalition. It would be up to the Board of Health, but really more of the Select Board, I believe, would be discussing that, or the Planning Board would be discussing that, the logistics. So it was a concern that Mr. D'Amato had, and he just said, "Can you please share this map?" So I'm not exactly sure how this is all. The Planning Board will have to make more recommendations about Marbella, of what exactly, how it's all going to look. There's two areas. There's a piece of sandwich area, and it looks like a bar. See the stuff in yellow, and then there's the common space. So the concern was taking a drink from the piece of sandwich area and moving over to the area that has the bar. So I think the planning board will have to kind of figure out a little bit more about the logistics, whether it's a server that might be able to move the alcohol from one area to the other. I'm not sure how that will work out. maybe they can't move from one area to the next area. I'm not sure where exactly the alcohol will be served. Maybe they just can't bring it across the hallway. You know, maybe, you know, drink it in one area, and so they're gonna have to, you know, work on that. Get some more information. I don't know about that.
And Caroline, can you just give an update on the project that's going on in East Milton? I know you guys were involved in that with the rat
Milton
traps.
residents.
Yeah,
Yes.
yeah.
So
So
we were called, we were not approached by an email
mhm.
that there was some activity. They were concerned about rodents with the demolition at the site. And my staff, Emily and Carolyn, went out to look to see where the rat traps were placed along the perimeter of the demolition. And there really was not enough traps that were set. And so I don't know if Emily wants to, or Carolyn wants to talk a little bit more, because I know that they were both working on that. Carolyn, do you want to chime in?
Yeah, I can chime in. So I think the last thing that left off with that is the construction site manager that I was in contact with, Michael Pratt. I don't think he's there anymore, or there was a new contract manager who reached out to me after like a week of trying to get them to add more rat traps, and we didn't hear anything. So he had another person had reached out to me and also CC'd Nick Milano on the email, saying that Waltham Pest Control had just visited their construction site again and then added like 12 new traps around the perimeter. So that was good. And then I had them send photos in just to make sure. And I had let them know to also keep us updated on whenever they come to visit, to like reload the traps and to send us the invoices for that.
Good.
Yeah, no, I think that's great. There's a whole plan for that. So there was a whole plan. And you guys hearing an echo?
Yeah.
Yeah, I'm hearing an echo. I don't know. And anyway, so there's a plan for that. So the construction management company was supposed to do the traps every so many feet and so forth. And so that's why this gentleman reached out. And I'm glad you guys have been right on top of it. So that's great. That's it for me.
I'm just going to speak now. Do you hear it echo with me too?
Yeah.
No, I don't.
Right.
Not now.
I'm going to put a couple of people on mute. See if I can get rid of that. Is it better now? Okay. Okay. All right. Any other questions regarding my health director's report? I'll move on to amending our health fee schedule to reflect private wastewater septic system plan review. We'll have a variable fee depending on the complexity of the septic system, discussion and vote to approve. So I have this schedule of fees in front of me, and I just want to let you know that right now, this is for our septic systems. Right now, our septic system plan review is $100. And our septic system, if there's any revisions, it's $50. And so the amount that we were collecting for our septic system plan reviews wasn't covering the cost of our consultant, Bob Brogna. So depending on how complex the system is, or if he has to go back and do some revisions, we wanted to capture the amount of money it costs. So it would be paid in full. So we have a permitized system, and we would figure out with Paul Brogna how much time he spent on the plan, and then at the end charge the fee. And the new language would say private wastewater septic system review will have a variable fee depending on the complexity of the septic system. And I did reach out to Cheryl Sabara, And she said, and I said it in my notes here, that she's from MAHB, that she said the Board of Health has the authority to change the fees. And it doesn't have to be approved by town council because you're an elected board or go through the select board. She said that you guys have the authority to change the regulation. So I was to capture the amount of money that it's costing to have the septic plan reviewed and to get that money. Previously, we had budgeted, so in the health department budget, we had $8,000 for professional services, and that was for our consultant, Paul Brogna. But after speaking with the town administrator, Nick Milano, he is decreasing everybody's budget, and he wanted to, he needs to find the money. There was cuts. And so by doing this, we would absorb that 8,000. We wouldn't have to pay the 8,000. The residents who have septic systems would be paying it according to the complexity of their septic systems. So it would, what we take in from whatever we pay Paul Brogna is how much we're going to charge for the septic system plan review. So we would eliminate this professional services fee for the consultant. So next year, our budget would be $8,000 lower.
So I have
And
a
we have-
question, Caroline, on this. Two things. One, I'm wondering if we should do a revolving fund that's specifically for this. Professional services kind of revolving fund. That's the first thing. And also would like to see what the schedule is like in some of these other towns with this kind of stuff. Because I certainly wouldn't want to be overcharging residents either, you know what I mean? So but I'm wondering if we should start to establish some kind of a fund like that. And then, it would make more sense. It would go into that fund and then it would pay for that consultant.
So I'll talk to Amy Dexter, and I have sent her an email, called her twice about it, and she is looking into this. I guess the question is, right now, the permits, these septic plan permitting fees, they all go to the general fund. So if we did do a revolving, I guess that's the question for Amy. Would they still be able to be put into the general fund? And I don't know if that's true.
Yeah, I don't know.
Be more of like, what's the easiest way to do this? I'll loop back with Amy again and say, what's the easiest way that we can do this?
Yeah, and I think also to see what some of the other towns are charging for their consultant fees on these things. Are we talking, $100 to $300? Are we talking upwards of 800? I don't know. You know what I mean? So, obviously, if it's a bigger system, and more complex, it's going to be more. But I'd want to be fair too. So,
I see in Plymouth, it's $750 for septic system plan review. We can take a look around and see what other towns are charging and put a list together.
Yeah, that would be great.
Helpful.
I
know
remember, I
Carolyn
think
did
like
do
last
some of
month.
that. Yeah.
Last month, Caroline had me look at all like the surrounding towns near us just to see what they were charging per septic like application, like their perk tests, their plan reviews. It does seem like we're charging way lower than all the other towns. I think like a drastic amount lower just for what we're doing. So that would make a big difference, I think.
Yeah. Yeah, it's probably true. It would just be nice to see some kind of a graphic that had that so that we could look at it.
Okay.
Thank
we can
you.
do that. So I'll follow up again with Amy and Carolyn, if you can put together surrounding towns, what they're paying for specifically for the plan reviews. That'd be great. So I'll keep this on the agenda for when we're meeting next, to see if we can vote for it, hopefully. We'll see. We'll get some time before the end of June. Okey doke. Anybody else have any questions about the fee? Okay, all right, I'm going to move on to number 7. Opioid abatement funding, spending, and community outreach. I think I already touched on that. Just saying that we're working with Sky actively. We have meetings with her every 2 weeks to review the focus groups and getting people to go to the focus groups and stakeholder interviews. So we've been working with Sky for that. Does anybody have any questions? And the recovery coach. I like to keep it on the agenda. No. And number 8's the community health improvement planning document. I don't know if you had a chance to take a look at that. Laurie and Emily and Ann, we all kind of worked on this, mostly Laurie, but we've been actively working on the chip. And we have a Partnership for Healthy Milton meeting on Wednesday to get some more community buy-in on this community health improvement plan. Because we do need to get buy-in from the community, like we had our community advisory group. And a lot of the people from the partnership are from the community advisory group. But did anything stand out to you guys? If you go to the last page, where we have all our strategies, and we have to get buy-in too. We had to figure out who's going to be responsible. I think that's the biggest challenge. Who's going to take it on? And the health department can't do it all. We are listed in a lot of them, but we have to get some buy-in from other entities or departments that we've reached out to. Now you can think about this. You can email me about this if you have any suggestions or something that you see that you would like to change.
I was just gonna say, I think that the food insecurity wasn't that like the number one thing that came out of the health?
So we have that on there. Food
Yeah, I see that.
food
Yeah, I'm just
insecurity,
saying that was a big one. And the
Right.
other thing I was gonna say is there was one further back towards the beginning. Health and Human Services Consortium.
Mhm.
And with BID Milton, I think that might be a good thing too, because they have to do some community benefits.
Right.
So that could, when you can bring them into something that we are doing, I think that's always a win, because that is part of what they need to do is being in the community. And so we could look at some of these a little closer and
That's
see
fine.
if there are things that they could help with, because they do have community benefits that they must do. So that would just be my thought.
Mhm. Anything else that you think? The Partnership for Healthy Milton is taking on the data dashboard. Intertown transportation, they're working on that, or the age-friendly Milton designation.
And some of this too, I'm just looking at the community health programming and education. The hospital does some of this too for the community.
Mhm.
So again, I think those kind of partnerships where you can partner with
Yep.
things that are already going on are always helpful too.
Mhm.
So
Agreed. Anything else that anybody sees? You can email me if you have a chance to look at it again and comment. They said we're gonna be working, we'll bring this Wednesday, the partnership meeting. Hope we finalize it in the next probably 2 to 3 weeks, hopefully. If there's something else that you, and then when we finalize it, we'll bring it back to the board. The board can do a final vote on it, so it's up to the board to vote on this. So get a chance to look at it. Let me know if you see anything. That'd be great. Okay. If I don't hear anything, we can move on to future meeting date. It's mine. Looking great. What you guys are thinking for the next meeting? Oh, I know, I talked to you, Roxanne, now that I'm thinking of the next meeting. Were we thinking on Thursday for the next meeting? Because we have to reorganize?
Well, I think you, like I said, I think you have up to 7 days to reorganize. So
Okay.
that's why it, Thursday, if it worked for other people, just you could do a quick meeting just to reorganize the board
Yeah.
and then do a regular meeting whenever,
Mhm.
that would be my thought, but
Yeah, that makes
because
sense.
otherwise it runs into town meeting.
Yeah, that's what we
That-
usually
yeah.
do. It's just a
Yeah.
quick,
Yeah.
All right, do you want to do it then Thursday? What time is good for everybody?
7 or anytime works to me.
Mary, you're
Otherwise,
on mute.
Earlier, 6:30?
6 too early for you, Roxanne?
On Thursday? No,
Yeah.
Thursday, that's fine
6
for me.
okay?
6
I don't know.
works for me.
Does that work for everybody else? Okay. And that'll be a Zoom, right?
Yes.
And what's the date on that one? The 20.
May 1st.
May
right?
1st.
May
Yeah, you're
1st.
right.
It'll be
Yeah.
May
Yep.
1st.
May 1st. Yep.
Okay, so Thursday, 6 PM, May 1st, reorganization of the board.
Is that enough
Yeah.
time? Do you have to post that?
I can post it tomorrow.
Tomorrow.
Okay.
Okay. All right, shall we adjourn?
Sounds good.
Yep, thank you.
Thank you.
Thank you.
Thank you.
Have a good night,
Thanks, everyone.
everybody.
Have a good night.
Night.
Good night.
Bye.